My name is Renée Boynton-Jarrett. I am a pediatrician and social epidemiologist. I work as an associate professor of pediatrics at Boston Medical Center, Boston University School of Medicine, and I'm the founding director of Vital Village Networks, which is a community engagement effort that began in Boston in 3 neighborhoods to promote child well-being by centering the lived experience, ideas, and solutions of community residents, community-based organizations, and through strategic partnerships and alliances, working to promote community capacity to build child well-being. Human rights is central to all of the work that we do. Our work really begins with acknowledging the dignity and rights of the child and thinking about ways in which we as a society have a collective responsibility to promote and support and invest in optimal outcomes for health, development, and well-being for every child. So our work at Vital Village was formed with that mission in mind to really achieve a society where the dignity and strengths of every child is supported. And often work is in silos. So healthcare, public health, education, social service, legal advocacy are siloed, they're funded separately, and they're very disconnected from the ideas, solutions, and wisdom of those who are actually closest to the challenges these separate silos are working to address. So, with Vital Village and our work, we really use a human rights framework. It is really a framework that brings in and centers dignity. It centers the understanding of how adversities and trauma in early life can have cast a very long shadow on your ultimate life chances and outcomes. It also truly centers the ways in which we need to acknowledge, respect, and understand the resilience, solutions, and wisdoms within communities. So we really work to uplift local wisdom and create spaces and opportunities for local community residents to partner with agencies, institutions, and organizations to do more collective efforts to promote child well-being and uphold the dignity of every child. I think the pandemic has just deepened my appreciation and understanding of the deep reserves of wisdom, knowledge, and resilience that exist within communities. Many of our community partners were exceptionally forward thinking with ideas, solutions, and strategies to make sure that resources, information, knowledge, and most importantly, social connections were not weathered and frayed by the pandemic. Now, we know the pandemic has caused tremendous levels of destruction, loss of humanity, loss of economic losses, emotional losses, and has deeply taken a disproportionate toll on communities of color that we work and partner deeply with. So that is the reality. But I also have a deep belief that without all of the leadership that has happened at the grassroots level within community, neighbor to neighbor, the consequence of this pandemic would have been far worse. And I only can hope that moving forward, we are able to build more resilient systems and policies that are integrating ideas and leadership from community members. The pandemic has provided a tremendous window of insight into how fragile the childcare and early care and education infrastructure it has been within this country. We absolutely need to prioritize policies and practices that support early childhood and better support parents when they have children between the ages of 0 and 8. So a primary policy that I would like to see advanced would be really strengthening the infrastructure of equitable pay, support, resources, and protection, such as PPE, COVID vaccines, and other things for essential workers who are early child care providers, as well as families that require early care and education, making sure that it is affordable and accessible to them. So, I think we absolutely need policies that are thoughtful and holistic for all children. Their learning has been significantly disrupted of K to 12 students, and our college age students has been significantly disrupted through the pandemic, as has their mental health. We need to have much stronger work in place to holistically support their health and well-being, not only during this pandemic, but post-pandemic and moving forward, just having a much more robust system in place. So those are two priorities that I think are really important. We are experiencing multiple pandemics right now. You know, the pandemic of COVID-19, but also acknowledgement of a very, very long-standing history of racial injustice that the COVID-19 pandemic has taken advantage of our structural racism and the ways in which our race-conscious society um, really creates vulnerabilities, creates and ignites vulnerabilities that have devastating consequences on communities. So I think a key priority for all of us at this time is really to reckon with our history, to reckon with our policies, and to really embrace anti-racist practices and policies as the key strategy for actually seeing us through this pandemic, but also rebuilding our future. And that very strongly relates to a Declaration of Human Rights. The key feature of racism in our society begins and evolves around denying members of society their acknowledgement and dignity as humans fully, and the fullness of those rights. So this is essential.